Dr. Vladimir Alexeyenko provides chelation IV infusions at Restorative Medicine IV Therapy in Manhattan. Dr. Alexeyenko discusses chelation therapy and heavy metal removal in this video.
Sushi enthusiasts, what they might face at some point if they I'm not necessarily saying overconsume or overindulge themselves with tuna, but unfortunately it may not be surprising to see a high mercury level on the blood work report. It's one scenario. People with artificial joints, including hip and knees, they might see elevated levels of cobalt in their system. Aluminum, guess what? It might come from the canned products, which is not very common, but it could be one of the elements. Let's not talk about arsenics. It's 21st century, but people who are concerned, lead might come from the paint and the gasoline. People who work on the gas station, they might it's not surprising to see elevated level of lead in their system. There is a solution for that. There is a chemical substance called EDTA. It is scientifically proven that this substance binds heavy metal, including mercury, lead, cobalt, aluminum, arsenics, and several more. A conventional blood testing heavy metal panel includes about 10 elements, but most of the people they're happy to see their mercury, lead, and mercury, lead, cadmium, cobalt. They're still able to check for cadmium and aluminum level. The medication we use for this process called EDTA, it does bind heavy metals. The protocol won't drip. The protocol, doctors use different approach, different amount of EDTA. The substance is very active. It binds, besides heavy metal, it binds certain type of electrolytes, including magnesium, including calcium, including potassium. So as a result, you cannot offer, there's no chance to offer pure EDTA product mixed with the sodium chloride, for example. We strongly recommend to mix EDTA with calcium, small amount of calcium. We add some potassium into the bag, and we add small amount of sodium bicarbonate as well. Normally 3 treatments at least. We recommend at least 3 drips. Talking about timing, I wouldn't recommend to use EDTA more than twice a week. In general, 3 drips, if numbers are not super high, is enough to see better results or 0 results, especially when it comes down to when we're talking about mercury, for example. In order to see better lead numbers, it might require 5 drips. Aluminum, well, we need a little luck. It could be a little bit stubborn. So we have to sit down and not like think, but I would recommend the person who requested or been advised to get EDTA drip for the aluminum, high aluminum, to check his or her blood after 5 drips and to see if there is improvement, good improvement, or resolution of the situation. If you're involved in certain type of occupation, if you work with metals, If you work in perfume industry, believe it or not, there is a chance to be. It is interesting. I started doing my investigation on that, but there is evidence that people who are working in perfume industry, they might they might have elevated level of lead in particular. If you see someone who's complaining of chronic fatigue, whose blood count looks a little bit weird, that's what lead might do to your blood count. It is so much easier to talk to someone who go to seafood restaurant every week. You might expect high mercury level in this person. Providing the advances in orthopedic surgery, we see more and more people with artificial knees and hips. And it's not something surprising to see elevated numbers of cobalt there. And these people, they might ask for a little help there. But my understanding that high levels of cobalt may not necessarily cause sort of symptoms, but it would not be healthy to have high levels of this heavy metal.
Learn more about IV chelation drips that Dr. Alexeyenko provides at Restorative Medicine IV Therapy by visiting the practice website. Patients who are interested in chelation therapy should call 917-994-9390 to schedule an appointment with Dr. Alexeyenko.